So for those women that are kind of going through that transition of perimenopause and menopause, what is what is your experience and practice with hormone replacement therapy, bioidentical
Mhm,
hormones
mhm,
versus
mhm,
traditional hormone therapy? This is
mhm.
like the question that comes up a lot in my practice. So
All
I'm
the time, all
curious.
the time,
Yes.
every single day. Of
Yes.
course, of course. So, yes, I think this ultimately goes back to what is menopause and what is the time before it, right?
Hmm.
Menopause itself is clinically defined as 1 year without periods. So we don't need lab testing to tell us we're in menopause with the if you are having cycles, like if you are having monthly menstrual cycles, or even if things are getting irregular, spacing out, 1 year without periods is the clinical diagnosis. Now, of course, there's, times when women have had their uterus removed. They have maybe a hormonal IUD or some other hormonal contraceptive method that is stopping their periods from happening, or potentially they've had some other medication or health concern, including cancer treatment, a lot of chemotherapy or radiation that could make the ovaries not function appropriately. So many different definitions for menopause. Perimenopausal changes can happen 7 to 10 years before. So if the
Hmm.
average age in the US is 50, 51 for menopause, there's a range 45 to 55 in a spectrum. Then 7 to 10 years before is when perimenopausal changes happen, which is why so much of this conversation is, women in their mid 30s, early 40s could certainly
Sure.
be experiencing some of these symptoms.